The Transparency and Accountability Program, TAP, at the Results for Development Institute works to increase the capacity of civil society organizations conducting research and advocacy to reduce corruption and inefficiency in social sector public spending. Talking about her organization's experience in supporting civil society organizations to conduct public expenditure tracking surveys and absenteeism studies is Courtney Tolmie, Program Director at TAP.
When we've supported civil society organizations to undertake public expenditure tracking surveys and absenteeism studies, we've really seen three major types of challenges arise. The first has to do with fitting the methodology to the objectives and research questions that an organization wants to achieve or answer. Public expenditure tracking surveys and absenteeism studies are really powerful methodologies, but they can't answer every type of question and they can't reach every objective. So it's important for an organization to identify early on whether that methodology is going to enable them to answer their research questions and reach their objectives. The second type of challenge we saw was around the issue of organization capacity to undertake this type of research. We work with a lot of organizations that have done expenditure tracking and absenteeism studies before, and so they really know the major demands on staff capacity and technical capacity to undertake these sorts of research tools. But when working with organizations that are new to the tool, it's important for them to understand early on what their staff needs are going to be and what their technical needs are going to be so that they can actually complete the study in an effective way. The final type of challenge that we saw has to do with political will. A lot of the organizations that we work with were able to identify results and recommendations from their expenditure tracking surveys and their absenteeism studies that had to do with improving policies to lower absenteeism or to reduce the level of leakages in public spending. However, if they found that policymakers were not interested in listening to them or didn't believe their credibility, it became extremely difficult for them to use their results to the fullest and push through those recommendations. The first piece of advice is to really scale the scope of your study to what your resources allow. It's very attractive to think about implementing a very large-scale nationwide study, but if you don't have the resources to do that, it's better to keep it small, but get a really good study and results out of it. The second piece of advice that I would give organizations particularly interested in conducting absenteeism studies is, first of all, to make sure that you do unannounced visits as opposed to just relying on absenteeism records. We've seen time and time again that records can lie, and really the only way to accurately figure out whether providers are going to class or going to health centers is to go unannounced and figure out if they're actually there. Along those same lines, it's really important to build the particular design of your study around what your hypotheses are. So, for example, we work with organizations that have found that absenteeism tends to be highest on Fridays because of events that happen on Fridays, things like teacher trainings and other events. If they had not designed the absenteeism study to see that absenteeism was highest on Fridays for teachers or health workers, they never would have been able to identify that cause and make recommendations to help overcome that. The third piece of advice is really about political will. The earlier on in a study that an organization can identify government allies, the more effective their study is likely to be. First of all, government allies can help an organization get access to the type of data that they need to conduct this study, and they also can provide a useful forum for organizations to present their recommendations later.